Acid-Base Balance by Trey Thornton. So we're first going to talk about metabolic acidosis and how it affects the body. When a person's body's pH level drops below 7.35, this is when metabolic acidosis occurs. This is an occurrence of an excess amount of acid or decreased amount of HCO3 is when it's present in the body, and overproduction of hydrogen ion leads to a pH of less than 7.40, which is followed by a reduced amount of HCO3 in an attempt to return the body's pH to normal levels. So next I'm going to talk about the forms of metabolic acidosis. These forms our most common forms come in lactic acidosis, diabetic ketoacidosis, acidosis caused by renal failure, acidosis caused by ingestion of toxins, and acidosis caused by diarrhea. Now we'll talk about a couple of these: lactic acidosis and diabetic ketoacidosis. Lactic acidosis is caused by the release of hydrogen ions in the body, which turns into lactate, creating systemic acidosis. And diabetic ketoacidosis is commonly seen in people who are diabetics and alcoholics. It causes a decrease in the body's pH when glucose utilization is impaired, resulting in fatty acids being metabolized, which produces ketones that release hydrogen ions, which in turn drops the body's pH level. So the body's compensation for metabolic acidosis typically comes in an increase in ventilations and an increase in depth of respirations. When the body's pH level drops below 7.35, metabolic system is unable to fix it. The respiratory system will compensate by increasing respiratory rate to blow off some of the excess carbon dioxide in the body, which can result in the body returning to a normal pH level. So pre-hospital treatment for metabolic acidosis is typically going to come in the form of fluids, with lactic acidosis being potentially caused by shock. You're going to possibly see a hypotensive patient. Therefore, the fluids can counteract that, increase the blood pressure, and maybe counteract some of the lactic acidosis in the long run. Or diabetic ketoacidosis, the fluids are going to help excrete some of those ketones out of the body, raise the pH level. And then in acidosis caused by diarrhea, you're going to see typically dehydrated patients that need those fluids to replenish the body. So next we're going to talk about metabolic alkalosis. We're going to talk about how the pH level rises in the body. There's a decreased amount of hydrogen ions and an excess amount of HCO3. And then we're also going to talk about causes and compensation. So for metabolic alkalosis, in terms of what happens, is your pH level in your body is going to rise above 7.45. This is caused by hydrogen ions, there being too few hydrogen ions in the body, and an excess amount of HCO3. Now for the metabolic alkalosis causes, compensation, and treatment, we're going to talk about what factors cause the rise in pH in the body, how the respiratory system compensates to try and fix it, and then pre-hospital treatment, which just typically includes normal saline and lactated ringers. So what factors cause the pH rise in the body are going to be a large amount of base sodium bicarbonate, calcium carbonate, and an excess amount of IV sodium bicarb. The respiratory system is going to compensate by slowing down, which in turn is going to cause an increased amount of CO2 in the blood as well as hydrogen. Now, the respiratory system will only be able to compensate for so long for metabolic alkalosis due to O2 saturation levels dropping because of the increased amount of CO2. The kidneys will take roughly 6 hours after the body's pH level rises above 7.45 to start excreting the HCO3 in the body. Pre-hospital wise, treatment is going to be to administer normal saline or lactated ringers, with lactated having a little bit higher pH level in it and the extra electrolytes. For respiratory acidosis, we're going to talk about carbon dioxide retention, Hydrogen ions, again, seems to be the big factor in all of this. Metabolic compensation then causes and treatment for respiratory acidosis. So respiratory acidosis and what happens. So what happens is there's a retention of carbon dioxide that's not blown off through the lungs in the gas exchange in the alveoli. And then there's also an increased amount of hydrogen ions in the body that don't get excreted, which in turn reduces the pH level to below 7.35. So respiratory acidosis compensation causes and treatment. First, you're going to see an increased urine output after a time of respiratory failure. That's going to be the metabolic system compensating, trying to excrete some of those hydrogen ions out of the body. And then respiratory acidosis is directly caused by respiratory failure. This respiratory failure is going to be caused by possibly opiate overdoses, airway obstructions, TBIs, traumatic brain injuries, asthma, COPD, obstructive sleep apnea, opiates, sedatives, hypnotics, and chest wall trauma. Your treatments for this is if the patient gets to the point where they're in respiratory failure, you're going to see where you either have to ventilate the patient with a BVM, RSI, intubate, or if it's a chest wall trauma, you could see potentially if you start seeing diminished lung sounds, you could have to decompress a patient. Next, we're going to talk about respiratory alkalosis. We're going to talk about excretion of carbon dioxide, excretion of hydrogen, hyperventilation, and metabolic compensation. So respiratory alkalosis and what causes this respiratory alkalosis is going to be excretion of too much carbon dioxide, an excretion of too much hydrogen, an overventilation of patients on ventilators, and then hyperventilations of anxiety patients. Respiratory alkalosis compensation treatment. If their respiratory alkalosis is sustained for a period of time, the metabolic system will counteract and try to fix the pH level by excreting bicarbonate through the urine and retaining those hydrogen ions. For patients on a ventilator, could attempt to reduce the minute volume, which is respiratory rate times tidal volume is how you're going to come up with your minute volume. Anxious patients typically are going to have an underlying issue of what's going on, but attempting to slow their respiratory rate while using breathing techniques or applying oxygen is going to keep them from passing out, because if they blow off too much CO2, they are going to go unconscious. So by understanding how metabolic acidosis, metabolic alkalosis, respiratory acidosis, respiratory alkalosis affects the body's pH level and how it attempts to compensate and remain in a state of homeostasis is extremely important for us as paramedic students and paramedics to know in a pre-hospital setting. In these emergency situations, it's extremely beneficial to understand what is going on with the patients, how their body is compensating for it, and how you can help treat these patients. This is the link to my Kahoot. I believe I've done it right. I think it should work properly. I tried it. It worked for me. And that is the end of my slideshow.